Medical doctor has revealed he may have infected many of his patients with COVID-19 after treating one who eventually died from the virus. Now, the doctor took a COVID-19 test after the patient had died, but his results came after 15 days, during which time he had been attending to other patients. Health editor Fred Smith, who is a COVID-19 survivor himself, spoke to the doctor, who blames the situation on the lack of PPEs and the delay in testing.
Oh, I think if you go to any of our hospitals, the private clinics, the teaching hospitals, the teacher hospitals, I think if you do mass testing of the health workers, I think you'll be surprised to find over. I would put it 70–80% of us would test positive, and fortunately we are not ill. We are asymptomatic. But the positivity rate I'll put in that region, because it is just about any ward you go to in my hospital has had a COVID patient mistakenly admitted there. And people will be there 2–3 days, then we realize that, oh, this is COVID. Or some people will test, some of them will suspect they test negative, and then with the last one done when they are dead, will come back positive. So I think the health workers are under assault. We are no more just front line. We are front, center, and whatever you would say. And for me, it's more of our families that scare me. We take these things home to our families. Yes, we may be asymptomatic, but you give it to a family member who will not be lucky and can become critically ill. Because this COVID virus deals with everybody differently. So the testing, healthcare workers, we should be routinely tested weekly. We should routinely test. I mean, if people are workers at other places are being routinely tested, people around, the high people, the important people are tested, their drivers, their security men are tested frequently, healthcare. In my case, because I was asymptomatic, and the results took, looking back, I should have, just because my patient was positive, I should have self-isolated. But you remember, I didn't get this communication from any official channel that, oh, your patient test was positive, so we demand that you go for a week or two. I felt, well, so I continued to come to work. Guilty that if I didn't come to work, my colleagues would think I'm putting all the work on them. Some of the doctors involved in the care, as far as I know, didn't go to test. I volunteered and went and tested, only to find out 3 weeks later that I was positive.
So during that 15-day period, what were you doing? Were you going to work?
I came to work. I came to work regularly. I did consultation.
You actually treated patients?
Sorry?
Did you treat patients?
Yeah, I touched patients. I treated patients because I sanitized, but I talked to patients. I examined patients. I did ward rounds. And only God knows if and how many patients I might have infected, unknowingly infected. That's the tragedy of the whole situation.
This is scary. What advice would you give in trying to improve management of COVID, especially in our health facilities?
The solution to the problem is obvious. First of all, the turnaround for the test should be to come within hours, at most a day or two of testing somebody. The results, we should have the results. As it is, turnaround time is going as long as 3 weeks or more. In fact, after my test was communicated to me, I voluntarily now stayed out. I took my whole family in to be tested. As I speak to you, it's been 10 days, going on 10 days, and the results are still not in. So, one, testing results the turnaround should be realistic, should come in time. And two, healthcare frontline workers should be mass tested, at least weekly. at least weekly. They should ever required to test. As it is today, when I met the group and I asked how many people here who have not gone to test since they started, at least 3 people raised their hands.
Now, currently, over 700 health workers are known to have been infected across the country. At least 2 have died. It's the reason the multimedia group launches the hashtag Save the Health Worker campaign today. Shortly, we'll be joined by Winston Amoah, who's leading this campaign. But just last week, the Ghana Registered Nurses and Midwives Association voiced concerns about the pressure faced by its members at health facilities in the country. We will listen very shortly, but let's now speak to Winston. Winston, what are we seeking to achieve with this campaign?
Well, Daniel, what we seek to achieve is the fact that you had the medical doctor make the point that he tested, and after 15 days, it came out that he was positive. So he's actually not sure whether he's infected some people or not. And you've also talked about how 770 health workers have contracted COVID-19, with 2 of them dying. Now, defeating COVID-19 is like going to a war, and the troops you have are the health officials or your frontline workers. So your frontline workers should be safe. Your frontline workers should be strong in order to help you defeat, COVID-19. So if they are challenged, if they are not strong, then what it means is that you're on the verge of losing.
Right. Winston Amoah there with our, who is leading the hashtag Save the Health Worker campaign, joining us to tell us how important it is for us to support the health workers now. Like I said earlier, some 700 health workers are known to have been infected across the country. At least 2 have died. It's the reason we are launching the hashtag Save the Health Worker campaign today. Of course, Winston will be joining us very shortly. But like I said, the Ghana Registered Nurses and Midwives Association have voiced concerns about the pressure faced by their members, right? That's a story that we'll bring you in later bulletins. But now, in a related development, nursing mothers in the Afram Plains district can smile, knowing that vaccines which will preserve the lives of their newborn babies can now be stored in an appropriate environment. Now, vaccines need to be stored in a cool place, so health workers on occasion keep them in refrigerators. Joy News story by Justice Bedu revealed Moses Gape, a nurse in the area, uses an ice chest to store these vaccines, which could be dangerous. Moses made a heartfelt appeal to the public for a refrigerator.
Moses Ganke is one of the country's frontline health workers, going at it alone in one of the places where many of his mates would rarely go.
Talking about the challenges, in fact, if I want to start, I can say I may not even finish.
This is the island community of Helen Haji. It has no electricity, no potable water, and no mobile telephone network. The only clinic here was built by the villagers themselves. Moses recalls how the lack of refrigerator for medicines affects the work that he does.
Just last month, I did 5 deliveries. During delivery, you have some emergencies or complications, and those drugs that you can use to ameliorate those situations are supposed to also to be kept under coating or in the refrigerator as well. But where is the fridge? The deliveries, you have to do it because you don't have enemies. By the time you say you are referring them, they might either deliver on the bank or on the lake.
He has to travel on the sometimes turbulent Afram River using a boat, a journey that sometimes could take up to 2 hours to the nearest community that has electricity every day to store medicines like vaccines.
The facility we are not having engine boats. So we have to rely on people who are having. They don't even have commercial boats that apply to where I store the vaccines. So I have to be begging them, making arrangements. So by the time they are done, it's almost getting to see something. I am appealing to the authorities, the government, Ministry of Health, Ghana Health Service, and benevolent individual or Ghanaians. This one I'm not just appealing, I'm begging. In fact, I don't know if I should be on my knee, but maybe it will disturb your recordings. Otherwise, I will be on my knee. For them to come to our aid, to save these innocent children.
Moses' story is like that of many health workers in remote communities across the country. He is hoping that something changes about that soon. Justice Baidu, Joy News, Helen Haji in the Afram Plains.